Hi, my name is Dr. Kristen Fox. I'm a veterinarian here at DePorre Veterinary Hospital. I'm also one of the practice owners, and I'm here today to talk about a tough topic, but I think it's an important one that we talk about and just trying to get awareness out there. We're going to be talking about today pet euthanasia, and just hoping that I can help you and your family maybe answer some questions about what to expect, as I know that's always a big concern for people as they're reaching that end of life stage with their pet. Typically, when it's time to consider euthanasia, I really think it's you knowing your pet and knowing when you start seeing changes that question if the quality of life of your pet is maybe not what you want it to be. That can present very differently, and so sometimes with cats or dogs, it can also show up differently. One of the things too is, if you're having these conversations with your veterinarian, sometimes there's a specific medical diagnosis where you're preparing that we know that this is going to be something that is going to force us to have to make an end of life decision. Sometimes that will help you prepare a little bit. Sometimes it's just normal aging and you're starting to see changes at home and you're concerned about what the quality of life for your pet is looking like. I do think dogs and cats do typically present differently, and that can also make a challenge. So I think for cats, we see a lot of them stopping eating, maybe hiding more, and some of those changes where you can tell that they're just not quite themselves. Cats are really, really good at hiding things, and so I think sometimes they do handle things longer, better, and then when things start to take a turn, it can happen really quickly, because they're so good at kind of keeping those emotions inside a lot. I think that a lot of times it can come as a bigger surprise for owners when they seem to be doing fine and then all of a sudden they stop eating. And when they stop eating, they just stop eating. And so that obviously brings a concern of, okay, what's going on? And is this something that medically can be fixed and this is just a small little bump in the road? Or is this kind of their way of telling us that their quality of life isn't good, they don't feel well, they're having discomfort, and we need to be considering a euthanasia conversation? I think with dogs, they're a little bit easier to see. I feel like sometimes they wear their emotions on their sleeve a little bit more. And so certainly changes in appetite. A lot of times with dogs, we're having a lot of mobility conversations with clients as dogs are getting older. And so sometimes it might just be, they can't do the stairs, they can't go chase the ball, they can't do some of the things that they've always loved to do. And so at a big picture point, I think it's really looking at what are the things that they love to do and are they still able to do those things? And I always encourage clients to maybe put a list together of some of those things that you just know your cat or dog loves to do, whether that's barking at the mailman, whether that's coming and rubbing up against you when you're eating your breakfast any morning. Cats will kind of come in between legs or rub up and, kind of mark their scent on things. Like if you start seeing some of those changes, sometimes that helps to have it as an objective thing that you can kind of look at, to say, okay, I have concerns that this is affecting their quality of life and that maybe their quality of life isn't what I want for them. And that's then when maybe it's time to have a conversation with your veterinarian. Do we need to have an end of life conversation? Are we doing the best thing that we can for your pet to manage any discomfort or any other medical things? Because we just really want to do what's best for your pet. And the owners that I work with, that's what they want. The most important thing is they want to do the best thing for their cat or dog, and we can help with that, kind of talking through different scenarios, and maybe there's medications, maybe there's things that we can do to make them more comfortable, and it just needs to be a conversation because every pet is a little bit different, and it's also a little bit different of how they show that maybe their quality of life isn't as good. So in my 21 years of practice, euthanasias have come a long way for the better, which is great. We use a lot of medications now to make this as smooth as process possible for the pet and for you and your family, because nobody wants their last memory of their pet to be them struggling or stressed. We want to make this as peaceful as we can for them. So a lot of times what we do now is we give them an injection of a medication just underneath their skin that helps to relax them. And with cats or dogs, we still are always placing an IV catheter to give them their final injections, which that final injection is what will stop their heart. But the goal for me is for every patient to be as relaxed and stress-free as possible, especially even for that IV catheter. We've all had to get a blood draw or IV catheter placed at some point. And, you know, there is a little bit of a poke that goes with that. And so if we can avoid that and avoid them being worked up or stressed during that process, we want to do that. So a lot of times we'll definitely give an injection ahead of time. Most of the time that will almost fully sedate them so they are completely relaxed. And then we would, at that point, place the IV catheter and give them their final injections. And we typically would go over that every step of the way so people know what to expect. For some pets, we'll have people give a medication at home ahead of time just to make them relaxed, even to walk in the door. Again, the goal is to make this as smooth and minimal stress for your pet as well as for your family kind of going through this difficult decision. I think emotionally, to expect and almost be okay that this is a big sense of grieving. You're losing an important part of your family, and it's normal that you're gonna have a sense of loss. It's gonna be hard to say goodbye. I think it really is hard for a lot of people to actually make the decision, because I think we all question, am I making the right decision? And that's where I think, going back to what I mentioned earlier, of trying to make it a little bit objective of what are the things that I know that is an indication that my cat or dog is not feeling well and doesn't have a good quality of life. And when those things, you know, when you have more things that they don't do than they still love to do, that to me brings up kind of then it's time to consider making a decision. So if you've gone through that and you've already, you know, you're making the right decision, if you've kind of got over that first hurdle, then I think being able to embrace and just the vulnerability of how difficult it's going to be to say goodbye, even when you're making the right decision for them. It doesn't mean it's not going to still be heartbreaking. You're losing a part of your family. You're losing somebody that has maybe been with you through tough times, and so that's going to be a sense of loss, and that's okay, and you know, that's normal. And so it's important, I think, that people just kind of expect that, because it's a big decision. So I think if you can get through first making the decision, then just being at that moment, having that time to say your goodbyes, and then afterwards being prepared that it's going to be an adjustment. And especially for owners who are taking a lot of end of life care up until the end, you know, I've had clients where they're making meals 3 or 4 times a day for their cat or dog, or, you know, they're giving medications, they're up through the night giving medications. You're doing such this level of intense care and nursing care that it's almost hard when they're gone, because your brain still thinks that you should have to get up and do those things. And so it is going to be a grieving process that's going to happen afterwards as well, even when you're making the best decision for them. And it doesn't mean you made a wrong decision. It's just part of that natural grieving process. I always try to encourage my clients to just let yourself grieve, let yourself have that time, because I think when people try to just move forward without just grieving that loss, I think they end up struggling longer because they second guess it. And so I think just feeling that loss, knowing it's going to be a big impact, and that's okay, that's normal. These are important parts of your family. I think hopefully that helps people be able to move forward when they're ready. So we always welcome any family members that want to come in for that process to say goodbye to your cat or dog. Depending on kids' ages, I usually just try to have a conversation. I generally don't encourage young children to be coming in, even kind of into that preteen area or preteen age. I just think it's hard for them to really understand the decision process. And I think sometimes being there and seeing their last memory of their pet being after they've passed is maybe not always the best memory. Typically, I tell clients, you know your children best. Obviously, we will respect whatever decision you make, but normally that's a conversation. I've had families of 6 to 8 people and we're all crowded in the room and everybody wants to be surrounding that cat or dog, and that's okay. So we kind of encourage whatever's going to make you feel the best and whatever you think is going to help your pet to and your family, because if that's going to help your family, that people can be there right up until the end, that's fine. I always go through that process with people, what to expect, because I don't think being there to the end is for everybody. There's a lot of people that just want to say their goodbyes. They want to remember them, how they were, and then they want to leave. And I always try to really comfort clients by saying, even though you're not going to be there, I will be there. My technician will be there. We will be there the whole time. Your pet is the number one priority, and so even if you're not here, we are going to continue the process. This isn't something where your pet's going to be waiting for another patient for me to see or anything like that. Your pet is the number one priority. So it just is a conversation that we typically have with people. Do you want to be present? Do you not? That's okay. The process for your pet will be the same. They're going to get an injection that's going to completely relax them. We're going to place an IV catheter and we're going to give them their final injections. I think it's just every person's a little bit different of what they feel is going to be the best thing for them and their emotional stability as well. Sometimes people decide they want to bring another pet. I see that more with dogs than cats, because I think cats coming in the carrier, I think is a little bit more stressful for them. But I do definitely have clients who say, can I bring my other dog? And I always just kind of talk through that with them of what's going to be best for you and your family. So I do think it's not a bad idea if you have another dog in the house, especially if they're very close, that after we finish the euthanasia, to maybe have that other dog come in and smell the pet that's passed away. My only concern when I have a client who wants to have a dog at the whole time is I just don't want that other dog to be a distraction, that you're worried about them and it's taking away your time saying your goodbye. Because that time, that once we sedate and place the catheter and start those final injections, it's a very short window, which is a good thing for your dog or cat, but it does happen quickly. And I just don't want somebody to be distracted, worried about their other dog, and then kind of feel like they didn't really get that time to just spend with their pet that they're saying goodbye to. So a lot of times with dogs, I usually encourage people, if you want to bring your other dog, maybe leave them in the car, and then after we're done, if you want to bring them in, they can sniff the pet that's passed away. Sometimes I think that helps them. I think that they do sense that pet is gone, even if they don't actually come in and smell that pet. But I do think it helps maybe people feel a little bit comforted that the other pet had their chance to kind of be aware as well. After the pet has passed away, there are a few different options for kind of the body aftercare. We work with a cremation local company. We've worked with them for 15 plus years. They do a great job. They treat these pets as you would treat another person in your family. It's all very respectful. Most people in our area elect cremation just because it's a little bit limited on options for burial. There are a couple local places that will do burials, and they do have some pet cemeteries, and I definitely have clients who will do that. But most people do elect cremation. And then the decision, it would just be if you want the pet's cremains or ashes back. And that's just a personal preference. Some people want the ashes back. They want to bury the ashes. They want to spread the ashes in a special place. They want to put them in a special urn or keepsake. And that's great. Other people don't necessarily need that, and that's okay too. And so it's just a personal preference, but that's always an option if you would like to have your pet's cremains returned to you. In addition to the cremation or burial, we do always offer a complimentary paw print, which is just a clay paw print. It's just an impression of your cat or dog's paw. We put their name in it, and it's just another keepsake. And sometimes people find that they don't really need the cremains, but they want the paw print. Some people want both. It's just, again, another option for people, just as a nice keepsake that we want to provide you for your cat or dog, just to hopefully help with that grieving process as well. You can always make an appointment to have a conversation with one of our veterinarians, kind of as an end-of-life conversation. And sometimes it's helpful for just people to come in. I've even had people where they don't even bring the pet. It's just, we kind of go through, especially if it's a pet that I've been managing, other medical things going on. But it's a good way that we can just have a face-to-face conversation, and we can talk about these things that we've even talked about here of, well, how do we know, is this dog or cat suffering? What are they doing? They're doing these things, but they're not doing these other things. And what does that look like? And hopefully we can help kind of guide that process a little bit. So even if you're not ready to make a decision that day, it's just part of that process of coming to making the right decision for your cat or dog. You know, I always tell people we can't take it back after it's done. So you want to make sure that you do really feel like this is the right decision. And we're always happy to kind of talk through that. And so making an appointment, as just having that conversation, is welcome anytime. I know this is a really difficult topic to talk about. Nobody wants to have to think about having to say goodbye to their cat or dog. We like to focus on trying to keep them as healthy as we can for as long as we can. But it is something that is an important thing to talk about. And I think being prepared and asking questions hopefully will help, as that difficult decision may have to come to something that you have to think about with your cat or dog. If you have questions, if you want to make an appointment to discuss anything, feel free to call, make an appointment. We're always happy to see you and have that conversation, evaluate where your pet is and what we can do to help, or if we think that we're out of options of things that can help, what does that next step in terms of a euthanasia look like? You can also make an appointment online, and if you have anything else we can help with, please let us know.